to the videos what I have been taking up nowadays on gynecology and obstetrics. So one of the very important and frequently asked questions in your professional exams is about the uterine leiomyomas. So actually, starting with the word myoma, oma, the suffix, wherever the suffix oma is referring, it refers to certain kind of a tumor. So when talking of leiomyoma, so leo, the word itself is suggesting that it's a tumor of a smooth muscle. Leo means smooth, myoma means my, wherever the sub myo is added, that is a muscle. So leo means smooth, myo means muscle, oma refers to a tumor. So actually in this video we'll be studying about the uterine leiomyomas, which is also called as the myomas. So this is also known in a general term as fibroids or fibromyomas. So beginning with, so leiomyomas or the uterine leiomyomas, they are the proliferative, well circumscribed, they are actually the proliferative, well circumscribed. So actually they have a definite margin and they are pseudocapsulated benign tumors, means they are localized to a particular region. So they are benign tumors composed of smooth muscle and fibrous connective tissue. So this is about the definition of the leiomyoma. Now, when looking at the most common benign tumors in the female pelvis. So this leiomyoma, it is the most common benign tumors which is found in the female pelvis, and it is present in 20 to 25% of the women of the reproductive age group. Now, when we look at the risk factors, the most important risk factor is that these leiomyomas are found incidentally in 25% of the white women and 50% of the black women. So this is one of the important risk factors of leiomyoma, that it depends on the race. Now, moving on to the next important risk factor, that is the age. So these leiomyomas are rare before the age of 20 years and common during the reproductive age, and they are not common after 45 years of age. So viewers, do remember that when we talk of leiomyomas in a general, in a layman terms, for the general population, it is called as fibroids. So most in general women, they mostly complain of the fibroids. So these fibroids are very common during the reproductive age group, and they are not common after 45 years of age. So do remember this. The next important risk factor, it is the early menarche. So in early menarche means those that is the onset of menses. So whenever a girl's onset becomes very early, actually it starts at the roundabout age of 13 years. So if early menarche is there, if early menarche is seen in a girl, so increased years of estrogen response will be there. So that girl will be having this estrogen exposure from a very long time. So if the menarche is starting between the age of 12 to 13 years, so if the menarche is that is the onset of the menstrual cycle, if it is rising early, so this is one of the important cause of the uterine leiomyomas. Apart from this, when we talk of the parity, it refers to the types of pregnancy. So most myomas or the fibroids, they are most common in the nulliparous. So those women who have never conceived, so nulliparous and relatively infertile women, it is very common. And most importantly, the important star point, what I need to differentiate, it is the parous women are at reduced risk of leiomyomas. So do remember, viewers and students, when we talk of the fibroids or the uterine leiomyomas, do remember that it is the parous women, they are at reduced risk of leiomyomas. So such women who have conceived, who have had pregnancies, so they are at a lesser risk, or they have reduced risk of getting leiomyomas. Apart from this, very important, the next important risk factor what can be looked upon as, it is the use of exogenous hormones. So do remember that the exogenous hormones, particularly the menopausal women, so it is given in the form of hormone replacement therapy. for reducing the symptoms of postmenopausal symptoms. So in postmenopausal women, actually the hormone replacement therapy in the form of estrogen replacement is given to them, and they are at risk, more risk of developing leiomyomas. So actually postmenopausal women, they have certain symptoms due to the lack of hormones. So they are given the what is commonly called as the hormone replacement therapy, which is called as the HRT. So menopausal women who take as estrogen as replacement, they are at the greater risk of developing leiomyomas. Apart from this, the next important risk factor for this uterine fibroids or the fibromyomas, it is the overweight and cigarette smoking. So the risk of leiomyomas increase with increasing body mass index. Means the more is the body mass index, the more is the weight, the more overweight a woman is, she is more predisposed to this uterine fibroids or the uterine leiomyomas. Apart from this, cigarette smokers are at reduced risk for uterine leiomyomas. So actually, it has been attributed that cigarette smokers, such women, they are at a reduced risk for uterine leiomyomas. Apart from this, when we look at the diet and the physical activity for development of the fibroids, what do we find? That those women who are athletes or they have the running capacity, so athlete, they have reduced lifetime risk of developing leiomyomas. So as I've already said, these are the smooth muscle fibroids, what are there. So since they are the smooth muscles benign tumors, so actually this athletes, they have the reduced risk of developing leiomyomas. People who consume red meat have twofold increased risk of leiomyomas. So do remember, students, it is very, very important that those women who are consuming this red meat, they have twofold times greater risk of getting this leiomyomas. Apart from this, people who consume high intake of green vegetables have 50% reduced risk of developing leiomyomas. So students and viewers, do remember that consumption of green leafy vegetables is having a is making the women less susceptible for developing the leiomyomas. Apart from this, when we look at the genetics, so for the occurrence of leiomyomas or the uterine fibroids, it has been seen that genetics also play a very important role, and it has got association with the formation of this uterine fibroids. So what do we have this? That the chromosomal abnormalities are seen in association in about 40% of the leiomyomas. And very importantly, the different types of chromosomal abnormalities which are seen in leiomyomas include that there can occur translocation between the chromosomes 12 and 14, the trisomy of chromosome 12, and deletion of chromosome 3 and 7. So this is another very important attributable risk factor for causation of the leiomyomas or the uterine fibroids. Apart from this, the next important risk factor, it is the very important risk factor, what I need to emphasize, that it is the estrogen dependence. So students and viewers, do remember that leiomyomas contain receptors. So actually these are well circumscribed, they can be encapsulated or they can be pedunculated lesions. So these leiomyomas, what are occurring in the uterine cavity, they are uterine wall, the smooth muscles of the uterine wall. Actually these leiomyomas, they have receptors for both, either the estrogen receptors, they are also there, as well as the progesterone receptors, they are also present. So the estrogen dependence has also been attributed to these leiomyomas, and these leiomyomas contain receptors for both the estrogen as well as the progestins. Leiomyomas are estrogen dependent. Very, very important, striking, distinguishing fact, that is, these leiomyomas, they are estrogen dependent tumors. So it is attributed that the high levels of estrogen in the circulating women's blood is the most important causative factor for causing the fibroids or the uterine myomas. So actually it is these leiomyomas or the uterine fibroids, they are estrogen dependent tumors, since they are very important, since they are rarely found before puberty and stop growing after menopause. So viewers, do remember, when we look at the risk factor for uterine leiomyomas, what do we see? What do we see? That it has been seen that rarely before puberty, because since it has got an estrogen dependence, so it has most estrogen is responsible for causing leiomyomas. So actually rarely before puberty, and they stop after menopause. So it is clear cut indicating that the presence of estrogen is the basic factor responsible for causing leiomyomas. Apart from this, new leiomyomas rarely appear after menopause. So again, this is a very important fact what needs to be memorized, that once the estrogen level in the blood falls, or the absence of estrogen levels or a lesser amount of estrogen level in the blood, so this can be the attributing factor for causing leiomyomas. So new leiomyomas rarely occur after menopause. So this is very important, that new leiomyomas, once the estrogen level in the blood is going to fall down, so new leiomyomas will never occur after menopause. Apart from this, the gonadotropin releasing hormone agonists, so the gonadotropin releasing hormone agonists, they create a hypoestrogenic state. So do remember, so GnRH agonists, they create a hypoestrogenic state, so that results in the reduction in the size of the tumor. So this is another very important factor what can be attributed to the estrogen. Apart from this, that is the anti-fibrotic agent, that is the pirfenidone, suppresses the tumor growth via its potent inhibition of fibrogenic cytokines. So this is one other very important factor which needs to be considered. So students and viewers, I won't take very long. In the upcoming next video, I'll be discussing about the epidemiological evidence of hereditability of this leiomyoma. Apart from this, the pathology and the types, in the next video from this I'll be discussing. So stay connected and thank you for watching.